I'm Dr. Raju A Gopal, Senior Consultant Endocrinologist from Kozhikode, Kerala. Presently, I'm working as a Senior Consultant at Endodiab Clinic, Kozhikode, and also at MES Medical College, Perindalmanna. Today, I'm going to speak about on a very important topic, that is prevention of a diabetic neuropathy. So, as you all know, diabetic neuropathy is a very important as well as very common complication of diabetes. It is reported in a large number of patients, and most importantly, it is actually may complain with the patient with very early course of disease. Generally, most diabetic complications happens after pretty long time of having uncontrolled diabetes. But as an exception, probably neuropathy can happen little earlier or much earlier than many of other complications. Before going to the management of diabetic neuropathy, briefly about how to diagnose. So generally, you suspect this problem when the patient complains of typical neuropathic symptoms like tingling of uh, especially feet, tingling sensation, or numbness. Sometimes patient presents of a very pricking type pain, and sometimes a burning type of pain, especially aggravates during the night. So this is the classical symptoms by most of the patients can present. With an advanced neuropathy, patient can also present with the loosening of their chapels, especially without any back strap, can actually cause losing out these chapels while walking by sometimes by knowing suddenly or sometimes even not recognizing whether their chapels have been lost from the feet. So these are the classical symptoms. And diagnosis is by the background of diabetes. Then you have tests like the OPD like test like which you can do at OPD is the filament monofilament testing, and also with biothisiometry, whereby you actually measure the vibratory sense is there with the patient or not. The loss of vibration is one of the earliest signs of neuropathy. So that is what we speak is being checked by this biothisiometry. If you have a doubt and if you really want to rule out from other conditions, a detailed nerve conduction study also will help, but may not be required in most of the patients when you are sure that diabetes is the cause of the neuropathy. Now, coming to the topic proper, that is how to manage. So, managing diabetic neuropathy is like any other complication of diabetes. The most important component or the most important factor is the strict control of diabetes. That is strict control of blood sugars. So you have to bring down the blood sugars to a normal, and you have to maintain the blood sugars for a long time like that. Then only this neuropathic treatment is going to work. So how can you divide that treatment? You can divide into both pharmacological and non-pharmacological. Pharmacological means with medications, and non-pharmacological is without medication. So the without medications means essentially it's a lifestyle modification. So what are lifestyle modifications? You need to have very good diet and exercise to prevent your blood sugars going high. So that is essential like for any other diabetic patient, even without any neuropathy also. So you need to have a very good diet and exercise to blood sugars to maintain your blood sugars normally. So part one. Second, you have to avoid smoking, and you have to stop using alcohol, or at least we have to regulate the use of alcohol, because both options can actually aggravate neuropathy. So, and also you have to make some other main changes once you have a neuropathy. If I'm talking about the prevention of neuropathy, you have to do the strict blood sugars control by diet and exercise, and avoiding smoking and quitting alcohol. But if you have a neuropathy as such proper, sometimes you have to make some other changes as well, especially footwear changes. So you need to have a dedicated footwear assessment, which one to wear and how to do that. And suppose a patient with the advanced neuropathy and having some amputation of the toes, they require specially designed shoes or other footwear for the patient. So this is for the patient who has already developed neuropathy and developed other complications like amputation of the fingers. So Prevention part, it is diet, lifestyle, and avoiding this smoking and alcohol. Now, the pharmacological thing is the control of blood sugars by medications. Again, as we stressed earlier, the most important thing is the blood sugar control. So you need to use all your insulins and blood medications to bring your sugars to a desired level, and you have to closely monitor and maintain the sugars the normal level. This is a major part. But apart from this, how the patient has got a neuropathy, they will have symptoms as we mentioned earlier, like tingling sensation, pain, pricking pain. Such pains have to be alleviated with the use of medications, which generally we use agents which reduces the neuropathic pains. There are plenty of agents to use for, and you have to use that along with your measures to bring down the blood sugars normally. Generally, it takes a longer time, like about 3 to 4 months, for the neuropathic pain to actually get a good relief. A certain relief will happen by the end of 2 or 3 weeks, but then it will take a longer time for the whole pain to subside. So, to conclude, the diabetic neuropathy diagnosis is pretty easy, symptoms and by simple test. The most difficult part is the treatment. So treatment, prevention, as well as actual treatment. Prevention is by blood sugar control, like in any other prevention of any other complication prevention. Plus, once the patient develops neuropathy, you have to use correct medications to come to reduce their pain, and also use good medications to bring down their blood sugars. Thank you.